Hey guys, welcome back for another episode of 5 Minute EMS Review. We are in our series on components of an EMS call and most recently talked about the primary assessment. So today we're going to be moving into the secondary assessment, and particularly we're going to be looking at secondary assessment of non-critical medical patients. So a couple of things we need to look at. First off, we need to define what a non-critical medical patient is, and then we need to look at what components we're expected to perform in a secondary assessment. So first, a non-critical medical patient is a patient that has no threats to their airway, breathing, or circulation, a patient that is responsive, and a patient that has no other immediate life threats that we can identify. So if they meet that criteria, we can classify them as a non-critical medical patient. Now, as we do a secondary assessment, some things that we're going to be looking for in our medical patients are the history of the present illness, using the OPQRST memory aid, the past medical history using sample, a physical exam. We always want to include a physical exam in our secondary assessment, and vital sign determination. Now, just like the primary assessment and other steps in the progression through an EMS call, we know that we lay things out linearly to try to understand the steps that need to happen. But in reality, the presentation of the patient may dictate something else. And since we operate in a team environment, we're often able to do more than one step at the same time. So we get that. But a couple of things that we want to try to lay out for the secondary assessment of a non-critical medical patient. First off, a lot of times in these patients, it's going to be really important for us to get the history of what is going on with their current illness and their past medical histories, because that may guide us as to what we need to do for a physical exam. So we may start in that area and move into a physical exam, or kind of do them simultaneously. And as we do that physical exam, it very possibly may be a focused physical exam on only one particularly body system, or several body systems based on the patient's chief complaint, rather than an exam of the entire body. So if that's relevant, if you can narrow down the body system based on the patient's chief complaint, a focused physical examination is appropriate. We want to get our vital signs. We want to use all appropriate monitoring devices, and we want to reassess these patients at least every 15 minutes, if not sooner. So that's a quick rundown of some things that we want to look at for the secondary assessment of a non-critical medical patient. I hope that you found it helpful. In our next video, we'll look at secondary assessment of critical medical patients. We'll hope you tune in for that one, and please share this channel with anyone else you think may be looking to learn a little bit more to help them in their progression in EMS. Thanks, and we'll see you next time.